Hello everyone. We are going to be doing this live session with Dr. Kassir and and he's come online. I'm just going to add him on now. Just waiting for Dr. K to come online. There he is. Hello,
Good
Dr.
morning
K.
or good evening.
Good evening for me. Good morning to you. How are you?
Good. How are you doing?
I'm doing well. So good to have you on. So for everyone who's joining us, Dr. Kassir is my good friend and my mentor. I mean, the person I look up to the most in the world of rhinoplasty. So he has a amazing practice in New York and New Jersey where he does more rhinoplasties than anyone I've ever seen. Like 4 or 5 rhinos a day. I don't know how he does it. He literally does not eat or sleep when he's operating. And I just want to share before we get started, I want to share a story about how we met. So I met him when I went to the US for my fellowship, and I just found him on Instagram and I wrote to him, "Hey, I like your work. Can I come and see you?" So then he said, "Yeah, sure, come on in." And so then I went there. And then the first thing he does, like within 30 seconds of meeting me, he's like, "You're from India? Tell me the 5 rivers of the Punjab." and I got 4 of them. I didn't get the 5th one, which he knew. And for the rest of my life, I cannot forget the name of the river Chenab. So thanks to you.
That's right.
And then we get to talking, and we found out that my dad and your brother are great friends, which was just
right.
an coincidence. And ever since then, we've been great friends as well. So thank you so much for coming.
My pleasure. Nice to be on.
Mm-hmm. So I've had a lot of questions already on my Insta for you, but before we get to that, I just want to take people. You've clearly done thousands of rhinoplasties, just a number which I hope to do someday. So I just want to pick your brain about rhinoplasty in general, so that people who are considering this procedure get some idea of what to expect and how to go about it. So I think the best question to start with is, in your mind, what makes a good rhinoplasty patient? What are you looking for in a good patient?
Well, I'll get to that in just a second. For anybody who's watching from our followers, I want you guys to know Dr. Aniketh is in Bangalore, India, so he's in southern India. And if you need anything in India, and because of COVID and the travel restriction and everything, please look him up. He's amazing. He's in South India. He can take care of you, and we kind of see the same. We have share the same philosophies. So back to what makes a good rhinoplasty patient, and that's a good question. So the thousands and thousands that we've done, the average, at least from my practice, and we've interviewed and done retrospective analyses of this, is it's usually a 23-year-old young woman. Okay, so what makes a good rhinoplasty patient? First of all, they kind of have to, fit into some sort of a demographic, and they're usually women. They're usually young, and they're bothered by, as they told us, because then we trust our data, that they don't like their bump, their tip, and the fact that it droops when they smile. So those things have to first bother them, or somebody has to be bothered by the look of their nose and also the function of their nose, and have thought about it for a while. And then they start becoming somebody that you can pay attention to and you can have a discussion with. And the bottom line is they have to have a problem that you can fix, and they have to be physically and emotionally ready for it.
Mm-hmm. So that leads, that's a good segue into my next question, as in what kind of patient would you say no?
We say no actually a lot. So the patients that you say no to are the ones that, basic rule in plastic surgery is, if you're talking to somebody during your whole consult and they don't smile, say no, okay? Because their mind and there's too much anxiety in there, okay? There's too many problems. The other ones that have unrealistic expectations, and we've talked about this before, but if you're wanting a whole different look, and it just can't be achieved with your anatomy and with your face and with your background and with your expectations of what you want, you got to say no to that. And of course, if they're medically or surgically not good candidates, like they have some sort of blood diatheses or medical condition that doesn't allow them to be put to sleep.
Mm-hmm. Yeah. So how do you think, you've done all kinds of ethnicities, how do you think Indian patients fit? Do you think our noses are a little bit easier, a little bit tougher?
That's actually good because, you know, I'm Iranian myself originally. So kind of Middle Eastern and Indian patients, we have, usually we have bigger noses and the skin tends to vary. But if you have bigger noses that just need to be reduced in size, made smaller, more aesthetic, and the skin is not that thick, it's amenable to doing surgery. But there's certain ligaments and cultural wants in, for example, Iran and India that don't exist with your average patient here. So you have to take those, you know, expectations into account.
Yeah. So even in Indians itself, there is a huge variety. I feel like South India, where I'm from, our noses are some of the most difficult to operate on because we've got these like really flimsy cartilages and sometimes these like really thick elephant skin. So it can be quite a challenge.
And that's again back to what we were talking about, you know, earlier in the discussion, is every person is different and you have to discuss that with them. So if somebody has thick skin, very flimsy cartilage, you have to tell them, look, I can tidy up your nose and add a lot of structure to make it sharper, but don't expect this. You can go from here to here, but not from here to here.
Yeah. So like when a patient comes to you with like a photo of a celebrity or stuff, I mean, how do you find that? Do you like it? Do you think it's a good thing, or do you prefer them not to do that?
So, you know, when somebody comes in with pictures of celebrities, 25 years ago, they used to tell you, you know, make sure they're not a good candidate, kick them out of your office. But it's not true today. To me, I hear what they have to say. Then I see the photo that they show me. For example, let's just take two extremes of a natural nose and a doll nose. If they tell me they want a natural nose, and they show me a picture of a doll nose, I point that out to them. I'm like, look, you just showed me a picture of a doll nose, but you told me you want natural. So which one is it?
Yeah.
And then that defines the semantics for them.
Yeah. So yeah, that's the challenge I always face, where they want it to be as small as possible, but so natural that no one gets to know that they had a surgery done. Right?
Exactly.
Those two don't go together.
No,
you
they
can
don't
have
go
one
together.
or the other.
They don't go together. And, you know, so what we tell them is, look, if you want as small as possible, your nose will look different and your face will probably look a little different. People probably won't notice. They might look to say, did you do anything to your hair and stuff? But, you know, your nose will look different. It will look more feminine. It will look smaller. So prepare for that. Understand that there's an adjustment period and prepare yourself mentally for that. But, you know, some people, it's interesting. Some people over the years say, you know, nobody noticed and they're happy about that. But then some people say nobody noticed and they're unhappy about that. So you can't please them all. You can't win them all.
Yeah. So how did you come up with your philosophy of the designer rhino? For those of our viewers who don't know, Dr. K created the designer rhinoplasty. And that's something that I learned a lot from. And so how did you come about that?
So for me, you know, I'm in the New York area, and as you can see from COVID, it's the center of the world in terms of how many different people live here and everything. So we have, at last count, operated on people from 133 different countries. So we don't have one type of nose, okay? So if you're in Iran, you have the Iranian nose. If you're in Turkey, you have the Turkish nose. If you're in India, you have kind of the Southern Indian nose and the type you were talking about. But we have Southeast Asian, European, you know, American, South American. So we have all the spectrum. So through that, I learned that one size doesn't fit all. You can't just do one technique. You can make certain maneuvers when you're doing surgery, but everybody thinks differently. Everybody's from a different background. Everybody has a different anatomy. So when you put the culture, the expectations, the anatomy, and the possible techniques together, you get like a custom design nose. That's why we call it designer rhinoplasty.
Yeah. So this brings me to my next question. You've been in this field for so long. You must have seen trends come and go. Initially, everyone was doing closed, then everyone was doing open, and right now the in thing seems to be preservation rhino. What do you make of that? That these fads, that I don't know, fads is the right word, but these kind of trends that just come and then just suddenly seem to go away.
You know, some trends stay and some go away. I think, you know, the actual preservation techniques are really for the bone, and those techniques have been around for a long time. Okay. Now I know, like Yves Saban and Barish, they really popularized it, and they've done tremendous work in that area. And I think if somebody's just starting out, preservation with rhinoplasty is a great way to start and kind of learn the whole aspect of rhinoplasty and kind of shorten your learning curve. But for my patients, I can probably do preservation rhinoplasty on 30 to 40% max, because we have flat, wide noses. We have noses that you have to add to. We have a revision rhinoplasty that you have to replace the structure to. So I kind of like a hybrid of those. But if you learn the preservation rhinoplasty technique and philosophies, it's definitely going to make your rhinoplasty operation a lot better.
Yeah. But as you said, you don't try and shoehorn preservation into every single case. There are some noses.
Not at all. Not at all. It just doesn't work. I mean, what if you have short bones? What if you have a flat, wide nose? What if you need to bring the alien? There's not much preservation that has anything to do with that.
Yeah. So you do a lot of secondaries, and some of the secondaries I've seen you do are crazy. Like, I wouldn't want to go anywhere near them. What are some of the most common mistakes you see in that previous surgeons do? What are some of the common mistakes patients come to you with?
So that's actually a good question. I lecture on complications of rhinoplasties and how to avoid them. And so the first thing is taking too much off. Okay, so if you take off too much off the bridge, now you have a depression there, and there has to be certain height. So now you have a ski slope, and they didn't want a ski slope. Okay, now they look childlike almost, and it flattens this space out, makes their eyes look wider. So for that, you have to again add to fix. The second mistake that's made very commonly is not taking off enough or not reducing from here where the bone ends and the cartilage starts, and then they're left with a kind of a persistent bump here, a bulge, whether it's skin, cartilage, or bone, or all of the above. And that's called a polybeak deformity, as you know. So when you come here and you still kind of have a bulge like that. Yeah. So that has to be repaired. And then when you take off too much, the bone and cartilage, then there's a depression here, or the nose kind of collapses in. We call that the inverted V deformity, because you see a inverted V shadow here. So then you have to go in there and kind of build up the foundation again that just collapsed. And then you get asymmetric nostrils, lack of doing the tip, and it kind of goes from there. So there's, the skin, soft tissue mistakes, and then there's the structure mistakes, and then there's the functional breathing mistakes that all have to be corrected. Just fixing a septum, a lot of people don't fix the septum, which is the midline structure that divides your nose into right and left sides. So not only could that not help your breathing, but it can still keep your nose crooked. So these are very valuable things. If a nose is perfect, if you did a perfect nose job, but the nose is a little off center, that will bother your patient. Okay. So,
and another thing for our viewers is that Dr. K also was one of the first people to create the filler rhinoplasty, or the non-surgical rhinoplasty. And in fact, he and I are writing a paper, rather I'm helping him write it. It's all his work. I can't claim any credit for the actual cases. I'm just glad to be helping him with it. Of almost 2,000 cases of filler rhinoplasty that you have done. So how did this come about? How did you get this idea to do this?
So, we've been doing fillers, or at least I've been doing fillers in my practice since the mid-90s, okay? And so we were doing lips and cheeks and everything. And one of my patients was one of the housewives of New Jersey. Her name is Jacqueline Rita. And, she had an over-resected rhinoplasty done elsewhere, I think in Las Vegas. And she wanted to get that fixed. And, she was too busy, right? She was too busy to go under and get anesthesia. She was filming and doing all these things. So we said, why don't we just fill that? And the whole concept intuitively is a little off, because you're adding to my nose and you're going to make my nose look smaller. And the answer is yes, because your eye likes to follow straight lines, okay? It likes to follow forms and straight lines. So if you have a ski slope and I add to it, the nose actually looks better and smaller. If you have a bump and I add to it here and at the bottom, that actually makes it look better. I'm going to show you guys, whoever's watching, a couple of photos. So if you guys can see here, everybody on our Instagram account agrees, and they comment that this is a good-looking guy, but he was bothered by the nose, by the bump, and the fact that it drooped. And you guys will see this in our paper that we published. So this is having added to it. This nose has more volume, but you see the tip is lifted and the dorsum is straight. Okay, so That's what the power of a non-surgical rhinoplasty is, and you can do this in 5 to 10 minutes, no downtime, no recovery, none of that. This is what we were talking about just a moment ago about taking too much off. You guys see too much has been taking off here, and this bottom of the nose looks like a big ball, and it is not aesthetic. And this patient was very deathly afraid of getting another surgery, so we've added to it, made this contour better. This nose, volume-wise, is bigger than this nose, but it looks better and it looks smaller. Let me show you a few more. This is your just standard. If you just fill before the bump, a little bit after the bump, project the tip out, lift it right here at the bottom. Now you have a nice result, nice elegant result. And even though this nose is bigger, it looks better. Okay?
Yeah, it's a real, like, almost a magic trick.
It is. It really is a magic trick. And I mean, look at this. This is, again, just turn the tip up a little bit. Look how good it looks. And, you know, you guys can see all this in the papers that we'll publish. But, you know, look at this. A little bit of a bump there, a little bit of a bump there. The nose seems to be drooping. She's smiling. Everybody complains about the fact that, you know, they don't like their nose drooping when they smile. So we can fix that. And again, the beauty of this is that you can take it for a test drive if you're not sure of it, if you're not ready for a surgery emotionally, mentally, physically, financially. You can do this just like, you know, people do fillers before they get a facelift, and take it for a test drive. And it lasts about a year or two, and you can always do it again. So you know, it's very popular, and it's taken off all over the world. I'm sure you're doing a lot, right, Doc?
We're doing a good number of them, and it's getting more and more popular. And as you said, it's a great option for people who aren't yet ready to take the plunge for a complete rhinoplasty yet. And there's no one who's really going to get injected for the rest of their life in their nose. Usually, most of them, they like it so much that they come back to get the surgery done.
Exactly.
And actually, we had a few comments asking whether all of those were with fillers. I want to make it clear that every single photo that Dr. K showed, all of them were fillers. None of them were surgical. None of them had any surgery whatsoever. And it really is mind-blowing. You remember my reaction the first time I came to your clinic and I saw you do this.
It is, and you know, it's great because it takes the fear out. But buyer beware for everybody out there watching. You come in and we do a non-surgical rhinoplasty on you, just as Dr. Aniketh said, and you know, we have statistics on that. Chances are high, very high, in the 90s that you either do that again or you'll do your surgery, because it's you know, it's just so easy. Somebody's asking, Doc, do you have to remove the filler before surgery?
Yeah.
And you do not. It can be removed during surgery. You just wash it out as just sugar gels. And you know, while we're on the subject, please don't let anybody inject anything permanent or non-FDA approved into your nose. Okay, make sure it's reversible and dissolvable. Okay.
And even if they're injecting something hyaluronic acid, it better be someone who's experienced, because this is comparatively a riskier area of your face to inject. So you need someone who's experienced. And right now with Instagram, there are people all over the place doing all kinds of things. So people need to be safe.
Yes.
So we have a question.
You know, beware and you know, choose carefully. And whoever is injecting you for anything, let alone the nose, because remember, if the nose is injected and you get into a vessel, you can cause even blindness. So be very careful about that. But make sure they have a kit or they're prepared in case something goes wrong, and ask them about that and say, do you have the stuff that you melted with, which is called hyaluronidase? Do you have that ready? Is it drawn up? Have you had experience with this before? Somebody just asked, can you fix a crooked nose with non-surgical rhinoplasty? And yes, think about it as the filler takes the path of least resistance, and wherever you're crooked, you can fill the opposite side, the dipped side, and it'll make it nice and even.
So I'm just going to take some other questions now. We had someone asking, what do you do for thick skin noses? Could you talk a little bit more about that?
Okay, so thick skin noses. To me, a thick skin nose needs a lot of structure underneath it. So think about if you have a structure and then you put saran wrap on it, you see all the details. And if you think about it, if you have a structure and you throw a blanket on it. So if your skin is thicker, we need to exaggerate the structure underneath. The tip cartilages, we need to use tip shields, tip grafts, and really make your dorsum narrow and make the edges nice and sharp, because on a thin skin nose, it would be too sharp, but on a thicker skin nose, for example, I have thick skin, so I would have to do something a little bit more exaggerated under my skin, cartilaginous wise, so when the skin redrapes over and all the swelling goes away after a year or so, then you see as much detail as possible.
Mm-hmm. Another question was, what are the different kinds of rhinoplasties? I'll just take this one. So there are three basic ways you can classify it. One is in terms of how you approach the nose. You have an open, where you make a cut across the bottom and then inside the nostril, and closed, where you don't have this cut in the bottom. You just have the ones inside the nostril. Then based on what you're doing to the nose, you can have an augmentation or a reduction rhinoplasty, where you're making the nose bigger and smaller. And thirdly, from a more technique point of view, this is more for surgeons, you can have structural or preservation. Structural is where you're kind of rebuilding the nose from the ground up and you're reinforcing things. And in preservation, you're kind of like keeping things as they are and trying to do as little to the nose as possible. Would you add anything to that, Doc?
The only thing I would add to that is now you can, like I've done this for years, is a hybrid where for the bony vault, you can do preservation techniques but let's say somewhere needs a graft, then you can do structural augmentation techniques. So sometimes you can use a hybrid technique to get the best result, okay? And then every surgeon has their own style, and that's what you should look at, is the style of the surgeon, the type of look that they have, and make sure they're consistent and they're not just promoting things. But once you see tons of pictures and you discuss, you get a feel for somebody, then you can go from there.
Yeah. Plus the surgeon's got to make you feel comfortable.
That's right.
You got to trust him. We had a question, can you be allergic to fillers?
Can you be allergic to fillers? So in 25 years maybe 26 years of injecting fillers, I've never had allergy to any fillers. We've had bruising, we've had a little bit of swelling, maybe we've had a little redness. And if in the small percentage that theoretically can be allergic, that's the exact reason why we tell you, make sure it's dissolvable so you can just dissolve it, okay? When in doubt, if you think you're allergic, you can always do a little test spot under your arm somewhere and watch that for a couple of days. If that doesn't react, then you can do it on your face.
Mm-hmm. Another question was, we have someone who's a cleft survivor with a large parrot nose. She's asking two things. One, can she get operated at the age of 28? Is it safe? And two, can fillers help her?
So I'd have to see the photo, but if she has severe nostril asymmetry, I would doubt that fillers can help her. But sure, she can get surgery at 28. It's time. Everything's healed, and we do a lot of cleft rhinoplasty. So cleft rhinoplasty, the side of the cleft is usually down, and you need not only skin soft tissue rearrangement, you need a platform for the new nostril to sit on so it doesn't sink back down.
It's not just about the nose. There's issues with the face and the bony support underneath the nose as well, which need to be corrected.
That's right.
We have one patient asking that he's 58 and who's looking for facial operations. He didn't specify what, and if he can go ahead at that age.
Of course, 58 is kind of a high average of our facial rejuvenative surgery. So, like, let's say our facelift average is about 50, 51 now. When I started, it was in the late 50s, but it's gotten younger as time has gone by.
Yeah. And apart from Botox and fillers, what are the other preventive facial procedures that you would recommend?
I have a brother who's a dermatologist, so I learned a long time ago from him that, and your father is a dermatologist, so long time ago that the best things to do for yourself are avoiding the sun as much as you can, and when you're in the sun, wear a hat. And if you can't do that, put on some proper sunblock and sunscreen, and take care of your skin. That's really big as you get older. Some sort of exfoliation, some sort of proper nutrients for your skin done the right way. And the next things are, in addition to filling your face with fillers or doing Botox to stop the creasing and the movement, we have what are called energy devices now, whether they're lasers or ultrasound waves that go under your skin to tighten things up, or radial waves that go under your skin, or a combination. And they all have different names on them. I wouldn't worry about the name brand, like whether it's Coke or Diet Coke or Pepsi, but these are the techniques available, and in the right hands, and even threads to give them the fox eye look, or the high cheeks and such. In the proper hands, they work. Again, your expectations have to be set. In the wrong hands, they're just a waste of time and money.
Yeah, a lot of this, I suppose it also depends on when you're doing them. If you're too far gone and you've got like really severe facial aging, then it's many times it's a waste of money. You're going to need something surgical in that case.
That's right.
One question was, hold on, how does smoking affect rhinoplasty?
Smoking is not good in a lot of ways. So now with COVID, that smokers are much, much more susceptible. So the first thing that it affects any kind of surgery is when you go to sleep, and we put you to sleep and there's a tube in your lungs. You want your lungs to be at best capacity, best operational abilities. And, smoking just clogs up your alveoli, clogs up your vessel, clogs up everything up. So from that sense, from going to sleep and waking up, it's not good. And specifically for rhinoplasty or facelifts and everything, it causes your blood vessels to constrict. Nicotine causes them to constrict. So there's no blood flow going where you've made cuts, for example, on a facelift. On a nose, if you make this cut and lift up, it could affect the healing of the flap. Because the nose is so, has such good blood supply, it probably doesn't do as bad things to the nose as it does if you do a facelift. But I would say, we tell anyone, if you're smoking, just stop it for a month before, and hopefully a couple of weeks afterwards. If you want to resume it, we don't want to know about it, but at least before your surgery, clean up so we can give you the maximal result.
Yeah. But I do think it's a little bit worse in thick skin, because in the thick skin, you're trying to get the skin to sit on your framework as it is. And anything that affects that it's going to make what is already a challenging procedure even tougher.
That's true. That's exactly right. So you need all the help you can get. You need to be as healthy as you can be. So we can give you the optimum result. Somebody is asking, talk about removing permanent filler. Why don't you tell us your experience about that?
Well, the best way to remove permanent filler is to not have it in the first place.
That's right.
But if you do have it, then there's usually no easy way to do it. You would probably have to do it surgically. I mean, it depends on where it is. It depends on where it is. If it's in the lip, I mean, I've seen you remove a silicone implant. Was it a little bit while ago? So in some cases, you might be able to do it through a small nick, and you just grab it and then you just pull it out. But in other cases, depending on where it is, how deep it is, you might have to be more invasive and get after it. It all depends on how much volume there is and at what plane it is. But it's either in any scenario, it's not going to be something that's really easy.
And I just have to add to that prevention is worth an ounce of prevention is really worth a pound of cure. So it's sexy and enticing for somebody to tell you, I can give you this filler and it'll last, you'll never have to do it again, and it's permanent. But just don't buy that, because fillers move with time. They get inflamed. They can cause infection, whether a day later, a year later, or 10 years later. So I've seen all this in my practice. So I think in different countries it's called different things, but it's Hylamid, biofilm, silicone. Just stay away. Yeah. The gels are safe. They don't last a long time, but that's a good thing. Okay, you want natural things happening to your face, because remember, if Dr. Aniketh and I have to cut here, dig under your skin, there's nerves and everything, there's scar tissue from the filler, you're taking a risk. So but that's the only way you can take it out, if you get in your face, and we've done that a lot of times.
So I have this I've noticed that patients want three things. They want it to be simple with no downtime, they want it to last for the rest of their lives, and they want it to be cheap. Yeah. So I tell them, you can have one or two of these, you're not going to get all three of them.
Right. And listen, we have we have some tenets, basic tenets in our office and in our practice that we tell students, employees, patients, and it's simply this: there are no shortcuts to quality. Okay, so if you want something that looks amazing, It's going to have to be done most likely by a reputable provider, whomever they are. And it's probably going to be done by FDA-approved products that are safe. And it's probably not going to be that inexpensive. Maybe relative to surgery, it'll be inexpensive, but some of these fillers and everything. So, it's worth looking good. And so we say if something's inexpensive and it doesn't work, it's infinitely expensive. So understand that a lot of things have to be right, but quality, there's no substitute for it.
Absolutely. Another question was, have you ever seen an inflammatory reaction or a biofilm a long time after injecting a filler? Like not immediately, much later?
Much later. Maybe once or twice we've had some persistent redness that shows up months later. And then you just have to melt that. But maybe if I would tell you I've done hundreds and thousands of injectables, maybe once or twice, maybe like with PLLA or known here as Sculptra, once in a while, if you don't do it correctly, you can get nodules. But that's about it.
Yeah.
It's pretty safe.
Another question was, can a diabetic undergo cosmetic surgery? I'll take this one. Yes, you definitely can. As long as your sugars are well controlled, there is no reason you can't undergo cosmetic or any other surgery. We have a lot of patients asking, 1, when are you coming to Kuwait? 2, when are you coming to Dubai? 3, when are you coming here? And finally, is your wait list long?
Okay, so I'll answer all of those. Pre-COVID, we had a lot of ambition and flying and everything, because I used to go to Iran at least once a year. Post-COVID, we're just going to have to wait to see what happens with actual flying and travel and the virus. Is there going to be a surge and so on? I have my Dubai license, so my plan is to come to Dubai in winter of 2021, maybe January of next year. I promised you that I'm coming to India, South India, maybe in the next 2 years. But again, COVID put a little, put that in the back burner. But, we're definitely going to do our best. And is the wait list long? Yes. So our wait list for rhinoplasty or any kind of surgery, if it's under anesthesia, is about a year. We have the international patients that we've told wait till we can see what happens with the COVID situation, especially in New York and New Jersey, has created pockets of space that we can fit in people before the end of the year. But things that don't need anesthesia for you to go be put to sleep, like surgeries under local, facelifts under local, injectables, non-surgical, all of those we can fit you in.
Yeah. So this is a good segue to discuss the pandemic in the room. How are you dealing with COVID with your practice? How are you getting back to doing cases?
So we're being very careful. We are reopening. We're not letting our guard down. So everyone that is getting a surgery is going to get a COVID test and be quarantined until the day of their surgery. We're gloving up and masks and respirators and all of that. Our surgical centers are, the airflow and all the regulations are tight. But the biggest thing is to make sure that no one with COVID comes in, right? And we're testing the staff and everything. There's 500,000, maybe close to 600,000 cases just in New York and New Jersey. So it's been tremendous. But, there's after 2.5 months, everybody's, they have pent up issues and they want to go outside and live their life again. So what are you guys doing down by you?
So we're in a lot better situation than New York. I mean, New York is really kind of the epicenter right now. Where I am, we have around 300 cases in our city. And for a city of 15 million, that's not too bad.
Wow.
Yeah. So, but even then, I mean, we can't afford to let our guard down, because you let your guard down and we could be the next New York. So we're doing a lot of the same things that you mentioned. We're screening a lot of patients. We're planning to start doing rhinoplasties from next week. And as you said, we're just making sure that they don't have COVID. And then even if they don't, even if the test comes negative, you still treat them like they do have COVID and you take all the precautions. And one thing that I tell my patients is that the COVID test isn't just for me. It's not just that I'm afraid of getting COVID from you. It's also for your safety. Because if someone with COVID undergoes a GA surgery, that lowers their immunity. And that COVID is going to be much more serious in them than if they didn't have the surgery. So the test works both ways. It's for your safety and mine.
of course. And you know, again, we want you to have optimal outcomes and everything. So somebody's asking, how do you do the fox eye look like Kendall? Do you want to take that?
Yep. I'll let you take that because that's not a very common request over here.
Right. So the fox eye look is when the eyebrow that comes down kind of goes up like this, and you have a little bit more of kind of that look. It's kind of trendy now. So what I suggest to patients is you can do a few things. You can do a little bit of what we call a lateral, which is the side here, lateral eyebrow lift with just Botox, okay, where you manipulate these muscles and how they constrict and everything. So you get a little bit of a lift that way. The second way is with fillers, where you can lift the tail of the brow with a little bit of filler after you've already done the Botox, okay, or the Xeomin or the Dysport. The third way, and it's really a good way, and a lot of people are foo-fooing it, but if done correctly, you can get a decent result, although temporary, is to put threads in here, okay? So you can bring some threads in and literally map your look that you want and do that, okay? And then, you know, that has a lot of discussion, how many times you need to do it, how long it lasts, and so on. But it's a great way to get started, especially in younger people, because it's a younger person's request. And then if you're ready for it, you can do, you know, a cat eye look or a lift through what we call a lateral brow lift, and get in here and literally reposition the canthus and the corner of the eyebrow. Again, those are very specific requests, but they seem to be trendy now.
Yeah. That's not so much of a trend over here yet. I don't know if it's going to come here. Usually what happens is whatever happens in the States, we get it a couple of years later.
Yes.
So another question was whether a lower facelift can be done under local. The answer for this is yes. Both Dr. K and I love doing things under local. So you can just anesthetize just at one area and make a small nick in the lower part of your earlobe and tunnel through here and just tighten this lower part of the face. I've seen Dr. K actually do an entire facelift under local, so he's a whiz at that. But it is possible.
Yeah. So I mean, the facelift, all the incisions are here, and you can be lying on the bed like this, and we're working on you here. So most people can handle a facelift under local anesthesia. When it gets a little bit tricky is if you want your nose done under local, which we've done in the past, but we suggest you go to sleep for that, because sometimes a little blood drips down into your throat and you want to cough it up and everything. So this is a little bit more difficult to do for the patient, not for us, than this. But no, a lower facelift for sure can be done under local anesthesia.
Plus, if you're doing osteotomies and you're breaking the bones, that can be quite scary. If you can hear the bone crack in your head, I mean, I wouldn't want that.
Speaking of breaking, speaking of breaking bones, can you comment on the different techniques that you really don't have to break bones with a hammer and a chisel, and why that's better for patients?
Yeah. So the older way to move your bones was to use what is known as osteotome. So it's kind of like a chisel with a hammer, and you break the bones that way and you move it in. But now you can also use their new machines called the piezo. So where you can, instead of breaking the bones, you're kind of molding it, you're kind of sculpting it, and you're kind of shaping it, so you don't have to break it. And also with the preservation techniques, in many cases, you avoid breaking the bones altogether. So there are all these different things that can be done. But an interesting point over here, I just read a paper yesterday where they're saying that with COVID, you should avoid using the piezo and all those kind of electric materials. So we might be going back to the old hammer and chisel for a while.
Right, because remember, and the piezo that Dr. Aniketh's talking about is an ultrasonic machine that it has somewhere over 30 to 32,000 revolutions per second, okay? So, but you have to use a lot of water with it because it gets hot. So there's water and everything splashing everywhere. So you want to make sure that you use minimal techniques, minimal disruption, you know, for the patient's well-being, so they have less bruising, less swelling, less recovery, and in the era of COVID, protect everybody.
Yeah. We had a question asking about, I hope you're not running late. I hope you have time.
No, we're good.
Yeah. So someone is asking about threads in the nose. What do you think of them?
You know, that's a tricky question, because I've even seen on Instagram how people are promoting it. And so, you know, listen, the threads go in, you can anchor them. Threads are really good anywhere if you know what you're doing. The problem I have with threads in the nose is the same problem I have with novices doing anything in the nose, because if any of those threads disrupt the blood vessel, you can get necrosis. I've seen it. I've seen tip necrosis with threads. I've seen scarring with threads when I went in and tried to fix the nose. So everything looks dandy, but you know, threads just don't have any business being in the nose. If you want your nose done, I would still stick with non-surgical. And if you're really okay with it, you can move to surgery. And threads, it's just a lot of digging around in the nose, and that, you know, increases your risk of something negative or bad happening.
Yes. And firstly, there's very little that threads can do that a filler cannot do. And secondly, a thread can make a subsequent surgery a lot tougher, whereas the filler is not going to do that. If you do the filler and then you go into operate, it makes no difference. But if the thread's there and it's caused a lot of scarring, that's going to make your surgery a lot tougher.
That's right, and limit the results that you may be able to get. Remember, the fillers are just gel. It's literally liquid gel, and you just wash it off.
Yeah. Okay. We had one question asking if fillers can help with the smile line. That depends. Botox might be a better solution, but if there's like a really deep line, then a filler would be useful. We have someone who's repeatedly asking if you offer medical elective opportunities for med students.
We do. DM us your information, and we will get you situated.
Mm-hmm. So, Doc, how have you been handling the lockdown? What have you been doing with yourself when you weren't operating?
You know, this is the longest period I've gone without operating, in 25 years. So, you know, initially there was the worry and the anxiety of, am I going to get it? Or, you know, is some family member or somebody I know going to get it? So we got over that, and the whole idea of having a pandemic and everything and the disruption in lives. But, you know, in the end, you have to really count your blessings. I have 2 young kids, a 3-year-old and a 4-year-old. So it's amazing having spent time with the family. And, you know, when you get up at 5:30 every morning during work hours and you show up at 6 and you're tired, it just wasn't working. So for us, it was good. I mean, we read a lot, you know, spent time with the family, got back to the gym. How about you?
I have learned how to clean my house. I've used a vacuum cleaner every single day, which I had not done before. I know you've done a little bit of that too. Sheila showed me what you were doing. And my wife's been cooking a lot. I've been cooking once in a while. But yeah, the first couple of weeks were the hardest. It was hard for me. I was just getting so frustrated and annoyed. Right. But then once you kind of leaned into it, it got easier. But I'm ready to be back now. I've had enough of it.
Yeah. We have too. A very interesting thing. I think a lot of companies are finding this. We did a tremendous amount of virtual consultations, and we did those since 2013 anyway. So for us, it wasn't anything new. But it was shocking how many, like for the last month and a half, I've literally been from 11 o'clock to 4 o'clock, one after another. And the patients are, you know, they have time, they can talk, and, you know, they don't have to get in their car and fight traffic. So in a way, business is still good as long as, you know, you can do it safely and reopen. But I'm like you. I'm ready to get back and get some blood on my gloves.
No, I think this thing is going to move us forward in many ways. But a lot of things are going to be online from now on. I'm going to take the last 2 questions that people had asked. Firstly, is 26 too young for Botox?
26 is not too young for Botox. I wouldn't even think of it as an absolute age. If you have, for example, frown lines or, you know, worry lines and, you know, forehead lines, and if let's say you're a teacher and your kids think you're angry all the time, it's a great time to do some Botox. Okay, so no, it's not an absolute age. Is it? Do you really need it? Okay, and that's what you have to talk to your physician about.
And the other question was, what do you think about fat transfer to the face? I do a lot of fat transfer. I love it, but it has its place, and fillers have its place. There's some cases where filler is better, like particularly like just an isolated tear trough or the lips, filler definitely does better. But for an older woman with a lot more loss of volume in this area, I like fat a lot. What do you think?
You know, I agree with you. I have to say, though, that fat sometimes has a mind of its own in the face. So first of all, it's got to be put in the right areas, or else the face looks off and it looks like a, you know, fish face. I agree with you that under the eyes, it's a little tricky. So, you know, for whoever's listening out there, the traditional fat transfer is what we call millifat, but now we can break it into smaller particles that are called microfat, and even smaller particles that are called nanofat. So you have to kind of mix and match so the fat doesn't lump up on you. But in general, what Dr. Aniketh said, it's great, it's yours. It can add the volume that you've lost. You just have to have enough experience to know who to do fat on, where, and why, if they have fat in the first place. Sometimes a lot of very lean, in shape people come in, there's really no fat to use. So
I'm going to wind down with one final question of my own. Why rhinoplasty? What got you into this? Because it can be frustrating at times. If you have a patient who's not happy, it can be sometimes unrewarding. And it's really, I think it was Roland Daniel who said that it's almost a gift and a curse to like the surgery so much. So what got you into it? Why do you enjoy it?
You know, my background was in ENT, and then I did facial plastics, and I did sleep medicine. But so, you know, and the face is, first of all, a fascinating place because you see it. You can't work out your way out of a nose or a face or anything. So these are things that don't change. And the nose, it's a central focus, it's the centerpiece of the face, and it's highly, highly, highly emotional to our patients, as you found out. You know, whether it really is a big nose or not attractive nose or a crooked nose, it's noticeable. And if that bothers the patient, it can have kind of devastating consequences on it. And I'm not even talking about the functional issues of breathing and all that. So it's a really important structure. And once you get into the psychology of it and the technique of it, it's incredibly rewarding to see the look on somebody's face when you've given them what they want, and it's incredibly taxing and difficult to hit a home run in every patient and manage expectations and that. So that's why they say it's the hardest plastic surgery. So, you know, for everybody out there who's listening, yeah, you know, we do our best. We swing for the fences every time, but you know, it doesn't work out perfectly in everyone. So you just have to be, you know, comfortable with your surgeon. You have to communicate with your surgeon in case that you need something else done, a steroid shot or revision, that it's part of your game plan. But no, it's incredibly satisfying. But you know, taxing when you've done it for as many years as we have, like just leaning over, you get neck issues. So no, but it's great. It's a privilege to be able to do this, and you know, we're fortunate that we're in this position that we can help people in this way.
So with that, I think we'll wind down. Thank you so much for joining. I think we went a little bit over what we discussed, but that's because we had so many questions. As always, great to see you. I was planning to come to the States this year and see you in person again, but we'll see when that happens. But we need to see each other soon.
Definitely. Be careful, everybody. Shout out to everybody in India and everybody all over the world. You guys be careful. Keep your guard up. Nice to see you, Doc. And everybody in India, Bangalore, Dr. Aniketh Venkataram. Okay? See you guys.
And everyone everywhere else, Dr. K, an absolute pleasure. And thank you so much. You stay safe. You're in the most dangerous place there is.
I know. Wish us luck. Bye, guys.
Say hi to Sheila and the kids.
I shall.
Bye. So that was it. Thank you everyone for joining us, and we'll see you again soon. Thank you.